Okay, while everybody is still joining, I would like to welcome you all to this evening's webinar as part of our nutrition series. Live transcription closed captioning has been enabled, and you can see it at the bottom. We're also recording this webinar, so if you miss anything, we will have it on our YouTube channel. You'll be able to view it later on. We'd like to welcome back Michelle McDonald. She is the clinical dietitian and certified diabetes educator at National Jewish Health. And she provides compassionate, comprehensive nutritional care to adult patients with various chronic conditions, including bronchiectasis, cardiovascular disease, kidney disease, COPD, gastrointestinal disease, interstitial lung disease, non-tuberculous mycobacterial disease, weight issues, rheumatoid arthritis, scleroderma, and type 2 diabetes. Michelle works closely with a multidisciplinary team of specialty clinics, counseling both inpatients and outpatients. She is dedicated to helping patients use nutrition as supportive therapy to manage and optimize health. Michelle completed a Bachelor of Science in Human Nutrition at Cornell University, a Master of Science in Food Science and Human Nutrition at Colorado State University, and a dietetic internship at the University of Northern Colorado. Michelle, welcome back. We are all looking forward to your webinar this evening on prebiotics and probiotics. This evening, as the webinar progresses, you will be able to put your questions into the Q&A. You type it in and hit send. If you want to send the question anonymously, you tick that little send anonymously box. After the presentation has concluded, I will be sharing the questions with Michelle so she can answer them. We will do our best to get to all the questions. If we miss any, we will do what we can to get those answers out to you as well. We would like to thank all of our supporters, including InsMed. Without the support of them and people like you, we could not continue to bring you this fabulous programming that we've brought you. This is our second year now of live webinars, and we're really enjoying it. We hope you do as well. Upcoming webinars next month. Next month. Wow, we're 2 days away from that, aren't we? Next month in October, we will have Accepting Reality to Reduce Suffering with Dr. Devin Smith, also from National Jewish. That's Monday, October 17th at 7 p.m. Eastern. So we will open registration for that soon, and we hope you'll join us for that as well. You can find us online on social media. We are on Instagram, Facebook, Twitter, and LinkedIn. You can also find us on our website, ntminfo.org, and you can see all of our past webinars and conference videos at youtube.com/ntmir. And if you want to keep up on our latest news and you have not yet signed up for our email newsletter, you can do that at ntminfo.org. Michelle, thank you so much for joining us. The floor is yours, and we are looking forward to the presentation.
Thanks, Amy. Let me get the presentation up. Okay, how does this look? Are we good?
We are.
Okay, thanks. So thank you for everyone who's joined. This is kind of an ongoing conversation. I actually wish I could see and be closer to people, but this format actually makes me more accessible to more of you and vice versa. So today's topic is prebiotics and probiotics. And this is a topic that I think is kind of a trend. It's hot, and it's also somewhat controversial. So I learned a lot just doing some reading for it. And again, I hope I can share some of what I've learned with you, and then I'm hoping to leave time for questions because I can maybe provide some more specifics based on specific questions for specific conditions regarding probiotics, especially. Okay, so in terms of an overview, I put together some kind of interesting information at the beginning under definitions and did you know? And then we'll look at gut dysbiosis, which is essentially the reason why prebiotics and probiotics are considered important, because there is this question of balance between quote unquote good and bad bacteria. And we'll look specifically at probiotics and prebiotics and how to get more of them in your diet and possibly otherwise in supplemental sources. And then we'll finish with some information on types of probiotics timing and dosing in order to guide you with this, because there's a lot of supplements on the market, and within the probiotic category, there's a huge amount of variation. Okay, so to start off, I generally like to start at the beginning and move forward, but I found it interesting that based on what traditional knowledge, we are sterile when we're in the womb, in theory, and then we're colonized when we're born. But there are some recent studies that challenge this and suggest that there are microorganisms in and surrounding the baby, in the placenta, the amniotic fluid, and the umbilical cord. And the fetus, by swallowing the fluid in utero, is probably beginning to develop a gut microbiota from the microorganisms to which it or we are exposed. So, and just to clarify, the GI tract means the organs that start, the hollow organs that start from your mouth and go all the way to your bum. Includes your mouth, your esophagus, your stomach, your small intestine, your large intestine, which is your colon, and your anus, your bum. And then the solid organs of the digestive system that aren't part of this hollow tube are your liver, your pancreas, and your gallbladder. So I kind of want to locate us as well. And so when we're born, we're colonized based on what we're exposed to, based on how we are born, whether it's vaginal or a C-section. And we start with a kind of fledgling microbiota. There's few species and there's few strains. And then we see this rapid expansion in diversity. And the diet is a key component in increasing the complexity of our gut microbiota. So I want to make this point. This is kind of entry place for prebiotics, but the colonization of our gut is influenced primarily by undigested and fermented polysaccharides, which are carbohydrates. And these are what prebiotics are. And we'll look at these in a little more detail in a minute. And these kind of short chain carbohydrates that are fermentable and not digested, they're fermented in the farther regions, or which is what distal means, of our intestine, like the colon, that area, to produce products such as short chain fatty acids. And it's byproducts like these that are thought to be beneficial to the gut in a variety of ways. And this is a big mechanism for how prebiotics help promote the development of a good microbiota. There's lots of others, but this is part of the mechanism. Oops. Okay, so as in terms of a definition, when I speak about gut microbiome or the microbiota, it is really the totality, or all the microorganisms, good ones, bad ones, even neutral ones, and their collective genetic material that's present in our intestine. So here we're locating. So while we do have a lot of mucosal surfaces or mucous membranes in our body, most of the bacteria reside within our GI tract. And I found this fascinating, but there are approximately 100 trillion total bacteria in our human gut, and most of them are in our GI tract. So in order to grasp this, there are, I think, about 8 billion people in the world right now. So we're going to round that up to 10 billion. So the entire population of the world is about 10 billion. So if you take the entire population of the world and you multiply that by about 10,000 times, then you'll end up with 100 trillion. And that actually helps me grasp this number, but it is staggering in terms of how many we have. And there are at least 800 different bacterial species that are categorized. And within those species, there are over 7,000 subvariants of those species. So there's an enormous diversity, almost incomprehensible. Okay. And then in terms of locating even more, the density of the bacteria or the microorganisms is high in the distal, which means far away small intestine, on the order of about 100 million colony-forming units per milliliter. So we're in the hundreds of millions there. It gets higher when you get into the colon, which is the large intestine. We're into the hundreds of billions to trillions of organisms per milliliter. So that's incredibly dense. And that's why, as we were saying, the gut is kind of where it's at in terms of microorganisms and the microbiota. In comparison, there are lower densities in the proximal or higher up intestinal tract, like the stomach, the duodenum, which is the early part of the small intestine, and the jejunum, which is the middle part of the small intestine. We're talking about hundreds per milliliter. And the reason is because we have a more gastric environment there, especially in the stomach. And then there's also the presence of bile and other enzymes that are secreted, digestive enzymes that are secreted into what becomes an alkaline environment in the duodenum. And also there's movement. So the concentration is in the later reaches of the small intestine and in the colon. So I wanted to show you, just kind of orient everybody. The esophagus comes up here, you see the stomach. So the upper part of our GI tract that contains a significant amount of microorganisms. You're going to see them a little bit less in the stomach. Then duodenum is the early part of the small intestine that attaches to the stomach. And then that's going to flow into the jejunum, which is the middle part of the small intestine. And that's going to flow into the distal or kind of farther away parts of the small intestine, which is the ileum. The ileum is going to cross over into the large intestine, which is the colon. And the colon or large intestine will ascend, it will transverse, then it will come down, and it will end up exiting. Okay, so that's where we are. In terms of other specific definitions, probiotics have been defined by the World Health Organization as live, non-pathogenic, so not harmful, microorganisms, specifically bacteria or yeast, which when consumed in adequate amounts, confer or give us health and beneficial effects to us. So there is so I wanted to highlight the fact that in the US, there are no specific definitions or standards for probiotics. The FDA does not recognize probiotics as a therapeutic agent like a drug. They're classified as a dietary supplement, which means it's a product that we take by mouth that's intended to supplement the diet. And because probiotics are a dietary supplement, they are not as regulated as tightly as agents like drugs. So that's problematic because there's less oversight, and as consumers, we can't be sure of what we're getting in any given supplement, and we can't also be sure that what we're getting does actually provide benefit. And I'll get into some more specifics here in a little bit, right here actually. So according to the World Health Organization, an organism or a bacteria or yeast must meet very strict criteria to be considered a probiotic. So it needs to be live, it needs to be viable, and usually what you want to look for a strain identification, which generally includes a genus, a species, and a strain, and I'll show you that in a minute. It should be of human origin, and it has to be able to survive the upper regions of the GI tract where a lot of the digestive juices are, and reach the distal or farther regions of the intestine. And in the farther regions of the intestine, it has to be able to function there and provide benefit. And maybe it does that by adhering to the gut tissue there, or having other interactions that are beneficial to the gut microbiota pattern, and thereby have a positive health effect on us. It also must be safe for human consumption. So this is a World Health Organization definition. It is not necessarily something that the US adheres to strictly, but this is the standard. In terms of prebiotics, prebiotics are dietary components. They're foods, but they're also components of foods that are undigestible dietary polysaccharides. And what I mean by that are really carbohydrates that these help the quote unquote good bacteria grow. I typically think of them, and I think they're commonly thought of as fiber, but that is a big generalization. Not all fibers will ferment, and not all fermentable polysaccharides or carbohydrates produce the same amounts and ratios of these beneficial short chain fatty acids and or have beneficial interactions in the gut. But as a general rule, you can think of them as dietary fiber. So that was probably a little bit of an orientation, I hope. In terms of gut dysbiosis, this is where there might be an opportunity for the benefit of including more prebiotics and probiotics, but conventional wisdom holds that the gut microbiome benefits our health when there is a quote unquote proper balance between good and bad bacteria. That's our current paradigm. When there's this good balance, in general, we'll have good digestion, good regularity. We will digest and absorb the nutrients that we're eating well. Our microbiota will suppress the growth of harmful organisms or bacteria that might cause infection. So they literally block them from being able to colonize and take effect and exert harmful effects. The microbiota also has good effects on our immune system. And those are gut benefits. That's where most of the study has been done in terms of the benefits of probiotics, but probiotics have also been shown to potentially be helpful in other diseases beyond the gut. So including, I think there is a reasonable link to lung health as well. Okay. So in terms of gut dysbiosis, in general, there are 4 ways that our gut microbiome can be put into imbalance or can be altered. So if you've been on antibiotics, and this is obviously a big one for anyone with bronchiectasis or NTMLD, but antibiotics in terms of the frequency, the duration, the intensity, all of which can be high in people who have bronchiectasis or NTM lung disease. So that's a big one because the antibiotics have antibacterial effects. That's by definition what they are. And so they will actually affect both good and bad bacteria. And the thought is that if there's an imbalance and bad bacteria outweigh the good ones because of the administration of antibiotics, then you might suffer the health consequences of that. Additionally, if you eat a diet that is therapeutic in terms of being healthful, and that includes both probiotics and prebiotics, then that may help, in theory, boost the good bacteria in your microbiome so that the balance is maintained. Taking supplemental probiotics can also alter your gut microbiome in this case, in hopefully a positive way. And then there is fecal transplantation, which I don't know that much about, but I've been hearing about it for quite some time. You actually inoculate, to use a scientific word, you take someone's fecal matter and you put it into another person, and thereby you're just actually you're trying to get the microorganisms of one person to colonize another. And there's some fascinating stuff with this. I personally don't have a lot of personal experience with it. I just think it's fascinating, but also somewhat difficult to warm up to the idea, but it's fascinating in terms of the possibilities here. Okay, so dysbiosis occurs when the balance between good and bad bacteria is disrupted. And then you might have this dysbiosis where, as I mentioned, the bad bacteria may take over and your health may suffer. So the idea is that prebiotics and probiotics could enter here. They could be beneficial for individuals with poor diets, older patients experiencing stress, particularly gut health issues, and those who may be taking medications that alter the gut microbial balance. And I don't have the full list of medications that could potentially alter the gut microbial balance, but I suspect that it is long, based on gleaning on the reading that I did. It seemed as though anything that you're putting into your gut can have an effect, because there are so many potential effects of medication on whether it's the epithelial lining or the actual compounds that are created in the gut that then become signaling molecules. So as far as I'm aware, in addition to antibiotics, there is reasonable evidence and linkages between, say, non-steroidal anti-inflammatory drugs and possibly also Tylenol, although I didn't find as much about Tylenol, but things that a lot of us take kind of without thinking about it sometimes if we need to take them. And that's not meant to scare anybody. It's just I think it's a fact of life that when we have a system like our gut that's open to the outside world, and we're putting food and or other supplements in addition to antibiotics or other medications, it's going to affect our system. And And the idea is to have a system that could potentially be restored by continuing to have a good diet, both with prebiotics and probiotics, and possibly in cases where you have a big alteration, it does seem like it's sensible to consider taking a supplemental source of at least probiotics. Okay, so how to get more probiotics. And I start here with fermented foods, but let me just say in general, most of the information for the general public on probiotics encourages people to just eat foods, particularly fermented foods, that are natural sources of probiotics. Supplements aren't generally recommended for the general supplemental probiotics, that is, for the general public because of the lack of specificity. In other words, the inability to match the specific strain that you need with a specific clinical condition. So my read of the current understanding is that eating foods is thumbs up and recommended. And then, as I just mentioned, I think in special populations, particularly people who are on intensive antibiotic regimens, I think it is sensible to consider supplemental probiotics. But people who have not been on frequent high dose of long duration antibiotics, maybe eating, we don't know, but maybe eating probiotics is potentially good enough. So not everyone who has these conditions has these long recurrent infections that need recurrent treatment. So to some degree, you also, if you're in the healthier category, or if you're someone who doesn't have lung disease, you have to weigh the cost versus the benefit. And generally the cost is the financial cost. In some populations, you don't necessarily want to supplement with probiotics because of the potential harms, such as if you're immunocompromised, either by medications like chemotherapy or other. And I think if you have some active gut infection, there's a potential for problems there. But in any case, I'm digressing a little bit. So I just wanted to give you the overview that eating more seems to be a good general recommendation for everybody. And fermented foods, I'll call out the ones that I have seen called out in the literature that I have read and talk about those to start because it's applicable for everybody. So a lot of people think of yogurt and a lot of people eat yogurt. And I guess what I will say is generally yogurt tends to be lower in lactose. So if you have lactose issues, then you can tolerate some yogurt better. But I have read reviews on consumerlab.com that actually say that some yogurts with live and active cultures have just as much lactose as milk. So to some degree, there's also a trial and error. But back to the slide. In general, the recommendation is to choose yogurts with what are termed live and active cultures. And ideally, the yogurt will list the actual cultures. So I found out that there is a seal. It's voluntary. It's not required. But the International Dairy Foods Association has a LAC, a live and active culture seal. And if a yogurt or any other dairy product that's fermented contains this seal, it means that the product has been certified to contain 100 million live and active cultures per gram at the time of manufacturing. And that's a lot. And what you'll see later on with the dosing, that would be considered a therapeutic dose. So I personally don't know all of the yogurts that have this seal, but I've started to look for it myself. It is voluntary, so it's not necessarily, if a yogurt does not have the seal, it doesn't necessarily mean it doesn't have a therapeutic amount of live and active cultures, but if it does have the seal, you can maybe feel better about it. So that's what I would tell you to look for. And then secondly, what I thought was interesting is that I saw it noted on a number of occasions that the starter cultures that are used to produce yogurt, the Streptococcus thermophilus and the Lactobacillus bulgaricus, don't meet the strict definition that the WHO has, the World Health Organization has for probiotics, either because they don't live or be viable to get far enough, or they're not don't have as many benefits to us. But so what this means is just because you're eating yogurt doesn't necessarily mean you've got a therapeutic dose of probiotics. So you want to see added live and active cultures. And you want to see the list. And I get to this later, but the most common probiotics that you're going to see, particularly in fermented foods, they're going to come from the lactic acid bacteria group, and they're going to be the lactobacillus or the bifidobacterium. Okay, other fermented foods. So cheese, if it's aged and not heated, specifically these types as examples: Swiss cheese, provolone, Gouda, or I think you say it Gouda, cheddar, Edam, Gruyere, cottage cheese. The heating process will decrease the amount of live cultures. And then kefir or kefir, these brands have been, Consumer Lab actually did a review in 2015 that found that these brands have high amounts of these live and active cultures. And I actually was just reading on their site before I got on here. I think they've done some more recent reviews. And honestly, it's hard to know what the consistency is between every batch and now what their formulations are. But I wanted to provide some examples of brands that have demonstrated, based on some reviews by Consumer Lab, to be good. Okay, other fermented foods. So, and I've put some qualifications on here, but kimchi can often be hot and spicy, and it's a cultural thing. I've only had kimchi a few times myself, and all of the kimchi I've had has been hot and spicy. So in general, because of the reflux considerations here, meaning that hot and spicy foods might aggravate reflux, I don't necessarily want to recommend hot and spicy kimchi. So I don't know if you can get a more mild version, but if so, that would be my recommendation. Kombucha is super popular. It's a fermented tea drink. And I generally would say, because of the caffeine in this and the carbonation, this might not be the best choice to get probiotics. So on the other hand, if you're going to have some of it earlier in the day, maybe taken with food that's going to absorb some of the fluid, would be best. But other good sources would be miso. So that's going to be a soy base, pickles, and specifically those brined in water and sea salt instead of vinegar to get more live active cultures. Sauerkraut, raw and non-pasteurized, which presents potentially another problem. I don't generally recommend non-pasteurized food items, but I'm going to leave that probably up to you. But the non-pasteurized version is going to not be heat treated and have more live active cultures. Tempeh is also another fermented food, which is a fermented wheat product. Okay, so other than eating more fermented foods, you can consider using a supplement. But I'm going to put up a caution here. There's a lack of specific recommendations for what strains are helpful for specific clinical conditions. I mentioned this before, but most supplemental probiotics and probiotics in foods are going to come from two main types of probiotics, the lactobacillus group and the bifidobacterium. Both of these happen to be part of the lactic acid bacteria group. When you look at supplements, you'll notice a lot of strains from these two, as well as a yeast strain, Saccharomyces. And in general, I like to recommend a probiotic that has multiple strains, just as it's just more like it makes sense to me. And I've read that a few strains or a combination might be better than one, with the exception, there's always the exception, but there's also the reverse holds true. And that is that Saccharomyces boulardii has actually been recommended for people who have C. diff to try and prevent the recurrence of it. So that is one single strain. And I think it is the only one that I'm aware of that has been recommended for the condition for having C. diff. And I will also add a side note, the American Gastroenterological Association released some guidelines in 2020 that tried to review which strains were beneficial for which gut conditions. And they only came up with 3 potential linkages. One was the Saccharomyces boulardii for C. diff. And Consumer Lab, as an aside, actually recommends 500 milligrams twice a day for the prevention of a C. diff recurrence. And so I do give that out. I don't think it's proven beyond doubt, but there seems to be enough evidence, even if it's potential low to moderate level, that has allowed the AGA to put that forward. The other two conditions, one was for a probiotic for necrotizing enterocolitis, which is in premature infants. So I don't think that was necessarily applicable. And then the other one was to prevent pouchitis, which is something that can occur when you have a surgery for ulcerative colitis. So that's also a very specific group. Okay, so going back to prebiotics in terms of how to get more of these, in general, I think it's good to just think of eating higher fiber foods. So your whole grains, like oatmeal or whole grain bread. There are some non-starchy vegetables. I would say all of them apply. I've just seen artichokes get called out. I've seen asparagus get called out numerous times, garlic, leeks, and onion. Of the starchy vegetables, I've seen corn, pumpkin, and sweet potatoes called out. And then with the legumes, we're talking about all beans, soybeans, but also all of your other beans, whether it's chickpeas or black beans or kidney beans, pinto beans, etc., lentils and peas. So all of these are foods that you can include in a healthy diet. Did I mention? No, let me go back here. In terms of, I forgot to add here that there are some additives that are prebiotics. So for instance, I'll see fructooligosaccharides that are added to typically processed foods like granola bars or sometimes supplemental bars or drinks. I'll see inulin added. I'll also see chicory. And sometimes I'll see those last two, the chicory and the inulin, and sometimes even the fructooligosaccharides in yogurt. They're added. And essentially, they're short chain carbohydrates that are undigested and fermentable. And maybe I'll add another side note here. I didn't call this out, but a lot of people have heard of FODMAPs in the diet. FODMAPs are essentially prebiotics. They are short chain fermentable carbohydrates. And what's a little bit ironic here is that some people with IBS are told to limit those in their diet because they cause digestive upset. It just so happens that those also are very helpful to prevent the growth of beneficial probiotics in your gut. So in general, I try not to have people limit those for a long period of time. In other words, people who are doing a low FODMAP diet, I don't necessarily want them to do that for an extended period of time. I want them to hone in on which ones are most problematic and be careful with those, but to try and liberalize their diet as much as possible otherwise, because we know there are benefits to the FODMAPs, not just downsides to them. Okay, so in terms of type, timing, and dosing, I wanted to put this in here because I think it will give you an idea of how to measure whether or not a probiotic is a good one. So in general, the World Health Organization recommends that probiotics be identified by genus, by species, and by strain. So as an example, Bifidobacterium, or say Lactobacillus, that's the genus or the genre. The second word there, lactis, is the species. And then the last strain name is at the end. And I often don't see this on food products. And I've read that manufacturers don't always, here we go, I put it here, don't always include it in their labeling. But what you're looking for in the ideal situation is this identification and then have it be linked to a clinical condition that you're trying to treat. And the linkage should come from good research, if at all possible. And there's lack of a lot of this information. So as I mentioned, in terms of a caution, a lot of manufacturers don't include this information in their labeling, not on food products like yogurt, for instance, or even on supplemental sources. Typically, what you'll see is manufacturers, they're making claims, but they're generalizing those claims based on other research sources. So they're kind of piggybacking, so to speak. And so this is a gray area, and I think has been allowed to occur because of the lax oversight and the lax regulation here in the US for dietary supplements. So because we know there's so much inter-strain diversity, which means even among the same species of probiotics, the variance among the same species, which is the strain types, there's so much difference between even strains in the same species, and there's so much variability in effect of specific strains based on individuals and the environment. So you could say age makes a difference in terms of the effect of probiotics. Geographic location has been shown to even make a difference. In addition to just the internal metabolic environment, which is going to include other things that you take by mouth, whether it's food or supplements or medications. So there's a great deal of acknowledgement in the literature that probiotics are so incredibly diverse, and they have very unpredictable sometimes or very diverse effects based on the host environment or the human that they're in, that it's very hard to link up specific strains with specific clinical benefit. That doesn't mean there isn't a potential benefit, but it's hard to make strong recommendations. Okay, so I do think there is potential benefit in considering supplements, especially if you will be or are or have been on a lot of antibiotics. And so I wanted to provide some kind of dosing range so you know what the therapeutic ranges are. And this is all estimated or speculated, maybe I should say, based on the research that is available today. So for probiotics, we want certain number of CFUs, which are colony forming units, per day, and 10 to the 9 is in the billions, 10 to the 12 is in the trillions. So when you're looking at numbers, you definitely want to be in the billions range or higher. And I wouldn't necessarily start with the most potent, because you might have some people have actually reported adverse effects when they take too many. I'd probably start with a relatively lower dose and then increase it as needed or as tolerated. For prebiotics, and this, remember, I think of this as fiber. So I've read actually 5 to 6 grams per day. The Harvard School of Public Health has a publication that says 5 or 6 grams per day of prebiotics are enough. I've also read as high as 20 grams per day in other guidelines. And I think that's just a good general rule in terms of eating that much fiber a day if your GI tract can tolerate it well, which means you don't have excessive cramping, pain, constipation, and or diarrhea with that. But that's something measurable that you can estimate based on the fiber content of the food that you're eating, which is right on the food label. In terms of the dosing schedules, generally what you'll see is in the literature that these amounts are taken once or twice a day, or maybe as infrequently as 3 or 4 times a week. And what has been shown is that probiotic colonization is temporary or transient. So it's likely that you need to continue taking it to get continued benefit. Okay, what else do I have? That's it for right now. That's kind of some of the bare bones. And I anticipate there will be questions. So I'm happy to try and be helpful.
There are questions. First one up, should I take probiotics with or without food?
That's a good question. So I think the most important thing with probiotics is that you should take them separated from any oral antibiotics that you may be on, because we think the effects are oppositional. So that's number one. At National Jewish, with people who are on antibiotics, we generally tell them to take their meds on an empty stomach, if at all possible. And so I will then generally say, take your probiotics with food, because that will be separated from the antibiotics that you're taking on an empty stomach. So I would say consider taking them with food, not only for the antibiotic reason, but I think it also may be helpful as a compliance means of compliance. In other words, you'll remember to take them maybe when you're eating. And other than that, I don't know that there's compelling reason to take them with food necessarily. I think if you're not on antibiotics, you could potentially take them without food as well, unless there's a specific indication on a specific probiotic, in which case I would defer to the package instructions.
Okay. Next question. If I eat yogurt at least 6 times a week, do I need to take a probiotic? I have used a line for years and my gastroenterologist wants me to stop and see how I do.
So I would refer back to my information on live and active cultures. So I would check to see if your yogurt contains live and active cultures, and if so, if there's the seal on it to indicate how many. If you don't know that, look to see if the cultures are listed on the yogurt, just to confirm that there are actual probiotics, say in the lactobacillus or the bifidobacterium genre, that have been added, because that would be a good indication. And if one or more of those things are true, and you're eating yogurt 6 days a week, which is most days of the week, then I would say, and on top of that, you don't necessarily have a prescription for a lot of antibiotics, then that may be enough for you, especially if you can add some of the other fermented foods to your diet.
Okay. If you have dairy issues, is it okay to use a probiotic coconut water like the one from Inner Echo?
I'm not familiar with, actually, I think I have seen the brand Echo, but I wasn't aware that there were probiotics in there. So so I don't want to repeat myself, but I would try and verify that the food product that you're eating does actually contain live and active cultures. And something like coconut water, my guess is they wouldn't have a seal on it, but if they're making the claim that there are probiotics in there, then I would think they should at least list this, the names of the group types, at least, like the lactobacillus or the bifidobacterium. Ideally, they would also list an amount. And if you can verify that, and or if I could, I don't think Consumer Lab has reviewed coconut waters, but the goal would be to try and verify that there's actually probiotics in what you're taking at a dose that might be therapeutic. That's kind of the bottom line with a lot of these questions.
So I just looked at their website, and apparently it's coconut water kefir is what it is. So
then there's dairy in it?
Apparently it's not. She's making kefir, but making it with coconut water, I guess.
Okay, and I'm gonna stop sharing so I can get online too, if that's okay.
Yeah, the website is inner-echo.com.
Inner Echo?
Inner-echo.com.
Oh, got it. Okay.
Oh, here. First question on FAQ. What cultures are in Inner Echo probiotic? Okay. Lactococcus lactis subspecies, Leuconostoc subspecies, Streptococcus thermophilus, Lactobacillus, kefir yeast, and kefir grains microflora.
I'm getting there too. Do they talk about amounts at all?
Hang on 1 second.
I think I'm here.
Okay. 100 billion colony forming units of good bacteria per serving at the time of manufacture.
I mean, so then that's their claim, and I don't know that you can find a third party that's actually tested this product, so you would have to decide whether or not you trust their claim. But at least I see it too. At least they have something on here. So,
and it does say that it's dairy free, gluten free, and soy free.
Yeah, I see it.
Wow.
I mean, this is interesting.
Yeah, something to look into as a possible alternative for people.
Yeah, because this also says that a serving size is 1 tablespoon.
Oh, wow.
Yeah.
Oh, they're packing a lot into that bottle. Mm. Mm. Yeah, the bottle, it says 30 servings per bottle.
Yeah.
Interesting.
I mean, it seems plausible. It is 15 mils. So
Yeah.
it certainly seems plausible.
Okay.
Mm-hmm.
All right. Next question. If I am lactose intolerant and have acid reflux, should I take probiotics because I cannot eat most of fermented foods? National Jewish Health recommends jarrow. How many times a day, if on the long-term MAC med regimen, would you recommend?
We generally recommend 2 twice a day, which is, it's actually it's 20 billion. That would be a dose of 20 billion per day.
Okay.
And I'm trying to think about, that's in the 10-9 range. So, and it's 5 billion twice a day, which gets you to total 20 billion. So it is in theory, it's in the therapeutic dose range for the jarrow. The first question, can you repeat that?
Yes. So this person said she's lactose intolerant and has acid reflux. Should she take probiotics because she can't eat most of the fermented food?
Oh, I see. I mean, I think so. In the face of an antibiotic challenge, I would say yes.
Okay. I was told today from a very credible source that this new probiotic Bio-K is the best one. Has anybody heard about it?
How do you spell it?
Bio-K. I feel like that is the product that is approved for a specific indication.
No, not as far as I'm aware, but let me look up Bio-K. Is it bio with a B?
Yeah, Bio-K.
Okay. So I'm on their website. And is this person talking about a probiotic supplement or one of their drinks?
Well, probably probiotic supplement.
Yeah.
Since it's
And okay, so I'm going to go to their 50 billion.
I mean,
Okay,
apparently they have probiotic drinks as well as capsules.
Yeah, so I'm just talking about my observations. So this is a lactobacillus gene. It's in the group lactobacillus, and they actually list 3 different strains, and they give the strains. So I find that to be helpful. Let's see what it says on here. And then if you go to the label, it says there's 50 billion colony forming units per capsule. It gives the strains, and let's see what. So, you know, I do like that they list the genus, the species, and the strain. They give the 50 billion. I don't know yet if this has been third-party certified. I also don't know what condition this person is taking this probiotic for, but we could look, one could look up these specific strains and see if they have been linked to any specific benefits. keeping in mind the research doesn't provide any strong evidence for anything other maybe than those 3 conditions I mentioned earlier, but there have been associations. So like Consumer Lab goes through, there's like a thesis on different probiotics and different conditions where there may be benefit. So I'm actually going to look while we're here online to see if that particular brand has been reviewed. If it's new, my guess is it's not.
It's not, I don't think it's new. I think it's actually been around for a while, but it started in Canada.
Oh, okay.
And looking on their website, it looks like they were at one point being used in hospitals in Quebec.
Oh, that's interesting. You know, one of the things that I thought was interesting in what I read is that one of the articles that I downloaded from PubMed said that 96% of hospitals were using some form of probiotic for inpatient care. I thought that was shocking, actually. But I don't know if 96%, I don't know if it's that high, but the fact that it's been being used in clinical care, these probiotics, I think is impressive. I think it's more prevalent than I realized.
Okay, here, and so this clinical trial is in Quebec. I'm reading on their website in 2003, there was some kind of health crisis in Quebec hospitals. I assume there was some kind of pathogenic issue. But BioK took part in a clinical trial to assess its effectiveness. The study proved its effectiveness, and in 2013, Health Canada approved the formula based on the published clinical data.
Oh, and so we don't know exactly what that problem was, but
no, we don't. We would have to dig for that, but
yeah.
But it has gone through clinical trials for some kind of efficacy. So I'd be interested to find out exactly what it is approved for.
Yeah, right. I'm actually looking. Consumer Lab has a really nice chart. I'm trying to find those specific strains to see if you can see how this can become time consuming. Let's go back here.
I do like the fact that there's a clinical trial.
Yeah, I agree. I mean, something is better than nothing, and the data is so mixed. It'd be nice to know exactly what they were using that for, like you said.
I will dig that up. I will find that answer.
Right, because you're interested.
Yeah. Can you recommend a pre or probiotic for MAC lung if we are going to be put on antibiotics?
So I'm trying to think about, so to some degree, well, what I will say is based on my experience at National Jewish, we've actually had good luck with Gero. It seems like it has helped a broad range of our patients. And to some degree, if people are asymptomatic, we don't know if, and they're on the Gero, we don't necessarily know if it's actually helping, but we have seemed to have had a good response to it in that people have fewer GI symptoms, particularly antibiotic associated diarrhea. So I do think that's a good general starting point. There are higher potency probiotics. There are other probiotics that will contain different strains, different genus, species, and strains. And I have had people move beyond the Gero who have ongoing symptoms even though they're on the Gero. So for instance, I've had people go as high as a product, the Dysbiosis product, which I think, as far as I know, that's is the most potent one that I'm aware of on the market. I think their prescription strength dose goes up to 450 billion colony forming units per capsule. So to some degree, I don't necessarily have one specific one, although I can tell you that we've had good experience with the Gero. We recommend that one to everybody as a starting point. And if it seems like you're continuing to experience symptoms, or if you have a new onset of symptoms like diarrhea or other GI upset, we might have you try going to a higher dose or through trial and error, or picking another probiotic that has different strains, like I mentioned. I have had people have good luck actually with Align and Culturelle for digestive issues. I've also had people have good luck, and this is all anecdotal, but with the Dysbiosis. Florist, and then as an aside, Floristore also has some indication for antibiotic-associated diarrhea. So that could be an alternative to try if Gero or one of the others doesn't seem to be working. And I think what I would try and do, honestly, is get you on a good general one for prevention. And then if and when you develop other symptoms that don't seem to be controlled by the Gero or whatever general one you're taking, then I would try and match up your particular issue with a strain that has shown some benefit for that. But that would be specific to say whether or not you're having diarrhea or something else.
Okay. I found the answer for BioK. I knew I wasn't imagining it. So in 2013, Health Canada approved BioK Plus as a new and effective means for the reduction of Clostridium difficile, or C. diff, infections in hospitals.
Oh.
Yes, it was it was the new BioK Plus probiotic formula. And they published, they published in several journals, and then they did another study, and in 2021, the study confirmed the effectiveness of BioK Plus in reducing the incidence of C. diff infection. And that was published in Clinical Infectious Diseases, which is one of the journals of the Infectious Diseases Society of America.
And I mean, what's interesting so when you said hospital pathogen, I immediately thought C. diff, but I wasn't sure. And what's interesting is that I haven't read about that in the reviews, like the American Gastroenterological Association did not mention that as far as I'm aware. So it's interesting that that there's not that kind of acknowledgement of.
It is interesting because the initial study in 2013, the clinical evidence was published in the American Journal of Gastroenterology.
Oh, that is interesting.
I don't know about the confirmation study, but according to this, in the confirmation study, they observed a significant decrease of 39% in hospitalized C. diff infection cases over an 18-month intervention period compared to the preceding 12-month observation period when they did not co-administer BioK Plus with antibiotics. And furthermore, the reduction in C. diff infection was higher than 50% in patient groups receiving multiple antibiotics. So there we have it.
So would you mind snipping that and sending it to me?
I will. Yes, I will do that. I will also drop the links to these.
Yeah. I'm interested in looking at that. C. diff is something that is it's more common than I think I realized. And we get a question about it a lot with NTM infections, and I always kind of wonder. I know that clindamycin is one of the antibiotics of concern for C. diff. Yeah. But I always wonder if we're just, if it's happening more than we realize because our patients are on so many antibiotics, and it's something we should be more aware of. Yeah, currently the only thing I recommend is the S. boulardii, which happens to be the active strain in Floristore. Yeah. So I would love to have more information on that.
I will send that over, drop that in as well so other people can read it. So we have a two-set question. Somebody started with, do you feel we're negatively affecting our lungs if we're unable to do either pre or probiotics? And then she clarified further down. She was asking about not helping lungs if you're not taking pre or probiotics and forgot, and she's saying this in association with NTM and bronchiectasis.
So that's a hard question to answer. I would hope that you could do some prebiotics in your diet, although I don't necessarily know what you're dealing with. And if you can't eat the probiotics or the prebiotics, maybe you could consider a supplement, I guess is what I'm wondering, because that would be the alternative. I don't know if I can't quantify at all how much you might be suffering if you're not taking those. I just think they might add benefit.
Okay. If someone has diarrhea, does that completely wipe out their gut microbiome?
Oh, that's a good question. I mean, I
I
I
feel
don't
like
know.
the chicken and egg question, like, you know, is their gut microbiome already significantly disrupted and that's what's causing the diarrhea, you know?
Mm-hmm. That's actually, I don't know the answer. I mean, the concept is if you have diarrhea, like in the case of C. diff, for instance, like I mean, okay, I'm sorry, I'm going to talk through this. Your gut microbiota is so dense. I find it hard to believe that you would be completely like, you know, cleaning it out so that you're never going to be essentially pristine. But there is a disruption in the barrier there and the microorganisms that are living there to protect it. So I can't remember what the question was now, other than I think diarrhea is going to be disruptive.
If someone has diarrhea, does that completely wipe out their gut microbiome?
Right. I think the answer is no.
But
I think
there's a significant disruption causing, or some kind of disruption. I guess whether it's significant would depend on how much diarrhea and for how long.
yeah, I think the concern for me with diarrhea especially is the lack of or the loss of fluids and electrolytes. That can be really can be harmful. Like that could cause a hospitalization. I mean, in third world countries, people are dying of diarrhea. So I'm probably more concerned about those losses. And then obviously you would want to try and rebuild that, which could come from stopping the cause of it and getting back to your normal diet and potentially trying a supplemental source just to, in theory, restore some of the quantity of good bacteria.
Okay. Next question. I took a probiotic supplement for a couple of months and I developed an intolerance to some foods I usually tolerate. Soy and corn were two of them. Is this unusual? It went away a couple of weeks after I quit taking the probiotic.
I'm interested in what the intolerance was. But what I can say is I have had people tell me that when they take probiotics, it actually causes some GI upset, whether it's in the form of diarrhea. Typically it's that, or gas and bloating, or abdominal pain and cramping. So I do think there can be gut side effects from taking probiotics.
Are those side effects, is that sort of as your body's adjusting to the new microbiome? Do those side effects tend to ease up, or is it a question of trying a different probiotic?
You know,
or a different dose?
I would say yes to that, to the latter there. Based on my experience, most people, when they get those symptoms, they don't want to keep on the probiotics, so they stop it. And generally the symptoms subside, and trying another one is completely reasonable, particularly if you're trying another one with different strains and different potencies.
If you take probiotic with food and take antibiotic at night, how long do you have to avoid food before taking the antibiotic?
Sorry, I missed some of the first part of that, but I would say a good 2 hours.
Yeah, they're saying if you're taking your probiotic with food and then you have to take the antibiotic at night, how long do you have to wait after the food before taking the antibiotic, I guess? I would think a few hours would be sufficient.
Yeah, at least 2 hours is what I would say.
Okay. I had C. diff years ago and take a probiotic every day. Should I also take a prebiotic?
So there are prebiotic supplements as far as I'm aware, but I'm actually not familiar with a lot of them. I just think, I think that you can, because I've read about them, but I would just suggest you eat those. I would eat higher fiber foods is what I would do.
Okay. What do you think about using the basic digestive enzyme as well as pre and probiotics?
It's an interesting question. So most people don't need digestive enzymes because their pancreas is sufficient. Having said that, some people anecdotally say that digestive enzymes do help reduce abdominal pain, gas, bloating, sense of fullness. And I think that certainly makes sense because digestive enzymes are going to help digest food, and most of us probably don't have a perfect digestive system. So I think they can be helpful. The downside potentially to digestive enzymes is that if you're refluxing them and they're getting it and you're aspirating them into your lungs, you're going to have there's more damage potentially to your lungs. So I know the ID clinic and sometimes some of the providers there really discourage against the use of digestive enzymes, especially on a regular basis. But you have to weigh the cost versus the benefit for yourself. And so I would say if they're helping you, maybe use them on specific occasions where you really need the help, and then try and make sure that you're taking them and staying upright afterwards, taking them with foods that maybe will anchor the everything that you're taking in your stomach rather than coming up. That's probably what I would say. And I don't think they will adversely affect the prebiotics or probiotics, so you could take them at the same time.
Okay. Why do some probiotics require refrigeration and others don't?
Yeah, that is a good question. Do I know the answer to that? My understanding is that certain probiotics are going to be more viable in a certain form. And if the probiotic has been formulated to be refrigerated and they recommend refrigeration, then it probably needs to be refrigerated. But it is true that non-refrigerated forms of probiotics can also be viable. So it doesn't have to be refrigerated. I don't quite understand. I don't quite understand it more than that. I just know that based on what I know and the providers with whom I work, non-refrigerated probiotics can be viable. That's kind of what has been most important in my work. And that's actually a good question. I might look into that more.
Okay.
Mm-hmm.
Yeah, there's a follow-up question further down. Is there a difference or preference between a shelf-stable versus a refrigerated probiotic?
Yeah. I think my answer today is no. As far as I know, they both can be effective.
Okay. Somebody said they missed the answer to the question about taking probiotics with or without food. Could you repeat the answer?
I think you can take probiotics with and without food. If you're taking antibiotics and have been told to take them on an empty stomach, then I will generally say take a probiotic with your meals or with your food, so it's inherently separated from the antibiotic which you'll be taking on an empty stomach.
Does it make sense to take a probiotic with many species, hoping that you will get a good mix for your specific microbiome? I have one that has 25 billion CFU with 12 different species.
I think that's a reasonable approach. I do. Yeah, I don't know, to be honest. I've read that, as I mentioned, that sometimes one strain is really effective, but more often what I read is multiple strains are better.
I have a follow-on question to that, actually, from something that I've heard. When you're taking probiotics, should you periodically switch up the brand so that you're maybe getting different species?
If the idea is to try and get a variety of species, then the answer is probably yes. I don't know that we know enough to know whether or not that's beneficial or not.
Okay.
And I think a lot of people who take probiotics take them for a specific reason. And if they have continued efficacy with like mitigating, like say diarrhea, then they don't then they don't necessarily need to change it because it's working.
Yeah.
But if you're just taking probiotics for the potential health benefits, I think that's probably a reasonable thing to do.
Okay. How long should I wait to take probiotics after taking antibiotics?
Right. At least 2 hours?
Yeah, I've heard 3 to 4, but I would say
Okay.
anywhere between 2 and 4. There you go.
Yeah, err on the side of more.
Yeah. Floristore was recommended to me. Can you comment on that?
Floristore, yeah. So that is the one, 500 milligrams twice a day that the AGA, I believe, says, and Consumer Lab, they both seem to recommend that there might be some evidence that that prevents recurrence of C. diff. It has also been shown to have some effectiveness against antibiotic-associated diarrhea. So if either one of those things are of a concern, then I would say that might be a good choice. It might be a good choice regardless.
Yeah.
And it's really trial and error, I think, after that.
And now we also know that BioK Plus is also a good option for
Potentially, yeah.
preventing C. diff recurrence.
Mm-hmm.
Somebody is commenting about the comment that digestive enzymes can harm lungs with GERD. How do we know if we're aspirating them? I guess you'd have to know if you have GERD and aspirate.
Yeah, yes, and some people are totally asymptomatic, so we may not know. This is all theoretical in a sense, but most people, even without lung disease, most people will reflux. And the question is it getting high enough to potentially breach your upper esophageal sphincter muscle and then get into the back of your throat or upper airway, in which case you could microaspirate it. In other words, it seems like it's probably happening, at least intermittently. That's the line of thinking that would then lead you to say, well, then in order to be as safe as possible, I'm going to try and minimize my supplemental use to just the ones that are really helpful. I'll take them with a minimal amount of water and take them with food that's going to kind of keep there's noise in my space here, and then take them with food that will increase the density of the contents of everything I'm taking. So the food and the fluid is less likely to move upward. It's a guess to some degree that it's likely happening.
Okay. I have a question actually from something that was in the presentation. You mentioned that if you're having aged cheese, you shouldn't heat it. What happens when you heat the cheese?
I think it kills the probiotics. So they're,
okay.
Yeah. And I think, when cheese is processed, there's probably certain temperatures at which they get the cheese. Those might be higher than what might happen if you're melting the cheese. I don't know the specifics on that, but so the less heat in terms of lower temperature, less duration of heating, probably the more viable cultures will be left.
Okay. All right. Wonderful. Well, that concludes the questions and answers. We've answered all of them.
Okay.
Thank you so much. Oh, wait, nope. I spoke too soon. Somebody says, and Floristore, no directions as what to take when. The fact sheet with the antibiotics contradicts. I'm not sure what the contradiction is. They've listed the antibiotics that they're taking. They're on Eliquis, Floristore, and pantoprazole. They haven't been given any directions as to what to take when, but the fact sheet with the antibiotics contradicts. Maybe if you could clarify. Oh, contradicts having no directives. I don't know. I mean, I think directives, I guess, in terms of taking
Or how to take them. Yeah.
The recommendation to take probiotics a certain time apart from antibiotics is that the antibiotics kill the probiotics.
Mm-hmm.
So if you take them too close in time together, you're just nullifying the effect of the probiotic. So you want to take them, with some like a few hours apart, so that the antibiotics have had a chance to get into your system, and then it's out of your stomach, and then you can take the probiotics and give those a chance to digest and settle into stomach. Why do the docs not tell you this? I don't know why, but I do know that it is all over our website and pamphlet. We do tell you this, and everything we have is reviewed. So I do know that the doctors who are reviewing our materials definitely have seen that and approved it. But thank you for asking this question and drawing attention to it again, because I think it's an important point to emphasize that, you know, when you think about probiotics and antibiotics, they really are sort of the polar opposite, right? So giving them a little time apart from each other will be, I think you'll get more efficacy out of the probiotic.
You know, Amy, and there are a couple of things I wrote down that I might mention if you're still willing.
Go for it, yes.
Someone had asked me by email about, and I can't remember what I said in the talk, but about gut flora and the lung and your gut microbiome and your lung microbiome. And that's probably an emerging area, much like probiotics in general, but I did read some articles that indicated that there is likely crosstalk via some plausible mechanisms, including just the bloodstream and signaling molecules. But it does appear that they influence each other. So there is the potential for benefits as well as potentially harms.
Not a huge surprise, I guess.
Yeah, not a huge surprise. I don't have a lot of specifics other than, you know, and again, we're back very much in the general realm of if you have a healthy gut microbiota, the idea would be that there's even brain connections. So, you know, your emotional state, your mood is better. Potentially your lungs are better off because of it. It's a very general statement, but that's kind of the realm in which we're operating in terms of why we'd want to include these in our diet or potentially as supplements. And then someone asked also about benefiber and metamucil, which are both prebiotics. Benefiber is wheat dextrin, which is basically a short chain wheat or derivative of wheat. And metamucil is a psyllium husk, which is a physical like husk. And they're both fermentable. They're both undigested. So they're both considered prebiotics. And so I had talked about supplemental sources, and I guess I could have mentioned those. And I'm sure there are others in the fiber realm. And those were the last two.
And I'm going to share my personal experience. If you take Metamucil, drink a lot of water with it. A lot of water with the psyllium husk because it forms this gel-like substance. So you want to take a lot of water with it. You know, going back to the lung microbiome thing, I just wanted to say two things. First of all, I've actually heard more recently that they're calling the gut the second brain, because of the number of neurons, number of nerve endings that are in even the short intestine. It's almost like competing with the number of neurons in the brain in terms of how many there are. There are so many. So it's probably not a surprise that there's a lot of that your gut is talking to a lot of your body. And then in terms of the lung microbiome, I encourage everybody to check out our YouTube channel, youtube.com/NTMIR. We did have a webinar on the lung microbiome. It is recorded and archived there. Nice. It was very interesting webinar, and I think you'll find it fascinating, so you can learn more about that topic as well.
Did they mention any connection with the gut?
I believe they did. There were questions about it as well. So yeah, it was discussed. And it is an emerging area of science. So really, I should probably circle back around with them and say, ask them if there's any updates that they want to give. There may well be.
Well, thanks.
All right. I think now we've done it. If anybody thinks of any other questions, like in the middle of the night, write it down and send it to us tomorrow, and we will try and get you an answer. But I'd like to thank everybody for joining us. Michelle, thank you for, once again, a wonderful webinar. It was very insightful and full of good answers. I think we all learned a lot. Good. And everybody, I hope you'll join us on October 17th for our next webinar. And Michelle will be back in November with another webinar on nutrition. Thank you, everybody. Have a good night.
Thanks, you too.